Hello, everybody. Thank you for being with us today. Today we have Melody Mejeh and Dr. Lauren Brand from KindPath, and they're going to be talking to us about democratizing mental health. So I'm just going to hand this right over to y'all, and you can do your thing.
Okay. Hi, everybody. My name is Melody Mejeh. I'm the founder and CEO of KindPath. I've been a product leader in the B2B and B2C product development space for 15 years, and I've had the opportunity to lead health equity and research initiatives in the digital health space. So I'm really honored to be here today to talk about something that hits close to home for me, how we can democratize mental health care and build something radically more human. I'll pass it over to Lauren to introduce herself next.
Hi, everyone. I'm Lauren Brand. I'm a clinical psychologist with a deep passion for supporting people living with mental health and addiction challenges. Over the course of my career in healthcare leadership, I focused on helping people get the right care at the right time, which is something that, as many of you know, I'm sure, can be incredibly difficult and very frustrating in today's fragmented healthcare system. And that's why the work that Melody and I are doing with KindPath that we're going to talk with you about today feels so timely and meaningful. Our goal is to harness the power of technology to break down barriers and expand access to mental health support, making it more responsive, compassionate, and truly empowering people to be in charge of their own healing journey. For me, that's not just professional and the right thing to do, but this is also a deeply personal mission for both of us. So let's start with where we are right now. Nearly 1 in 5 adults in the US has a diagnosable mental health condition. That's around 60 million people. And in the US, 46% of adults will actually meet criteria for a diagnosable mental health condition at some point in their lifetime. About half of people from both of those groups never receive treatment or support, not because they don't want help, but because they can't get it despite trying. Access to care is hindered by a lot of factors: cost, long waits, lack of availability, geographic barriers, insurance, stigma, and a disorganized and overwhelmed care system that just isn't designed to help. And what's worse is that most people don't get help until they're in a crisis, and often defaulting to the emergency room. We wait for people to fall apart before we show up, rather than helping to prevent a crisis. And that's backwards, and it's not working. So at KindPath, we're flipping the model and building something new from the ground up, focusing on preventing a crisis in the first place.
Yeah. And to tell you a little bit about what KindPath is an innovative emotional support platform designed to detect distress early and provide personalized support and validate real experiences in a way that feels human and not clinical. What we do is that we combine the daily check-ins that track your mood, your stress, your energy, and your sleep with machine learning, which helps us surface early signs of risk, personalized peer support to meet people where they are, and evidence-based micro-interventions that's rooted in cognitive behavioral therapy, mindfulness, and emotional regulation. And we're doing all of this affordably, digitally, and with a commitment to equity. At the core of KindPath, I'm going to get techie a little bit, but I'll try not to overwhelm here. At the core of KindPath is a lightweight but very robust privacy-conscious machine learning model. And that model analyzes your user check-ins over time. So it's looking for these subtle shifts in behavior, like drops in energy, changes in sleep, rising stress levels, reduced engagement, anything that signals that something might be changing beneath the surface. Now, instead of waiting for someone to report a crisis, our system proactively flags elevated risks and triggers timely interventions to help you in that moment. And that can look different from person to person. So it can be a calming message that's delivered at the right time. It could be a suggestion to reach out to a peer supporter. It could be a suggested strategy or a nudge to revisit a tool that's worked for you in the past. Or, when necessary, a guided handoff to a crisis line or a communication with your linked provider. So we're not trying to predict diagnosis. That's not really what we're about. We're trying to catch people before they fall through the cracks. And that's what makes KindPath proactive and not reactive. It's early detection plus compassionate engagement, really. And it's powered by machine learning, not an overwhelmed call center.
So why are we doing this now? Why this and why now? Right now, many of the mental health tools that are still out there reflect a system that ignores the actual input of users and is often built upon a foundation of guessing what people need. And they often reinforce barriers that, like high price points, using labels that are stigmatizing, and feedback that's not personalized to the user, often missing those little nuances in someone's life, like trauma, neurodivergence, housing insecurity, cultural stigma. So here's what we know to be true. When support doesn't reflect someone's reality, we know that it fails. And that's not a theory, that's actually backed by data. The research in this area shows that when care validates a person's actual real experience and circumstances, that outcomes improve significantly. And that includes promoting higher trust, stronger engagement, longer retention in care, and better outcomes. So that's why a responsive design and personalization is at the core of KindPath and what we're building. Our platform is designed to listen, reflect, and respond, not diagnose or dictate. So how we're democratizing mental health care is focused on our three core pillars. The first is accessibility. Our platform is mobile first, it's affordable, it's available to people in both urban and rural areas. It's not dependent on insurance, doesn't matter what kind of insurance you have. And the second pillar is early intervention. So our check-ins aren't just a feel-good feature. They help us to recognize distress patterns in users, recognizing these early, and then intervening before that point where they escalate into a crisis. The third pillar is community-based support. And here, instead of just relying on our overburdened system of care, we're empowering peer connection, validating that healing happens in community and not just in the clinic or hospital setting. And Mel, I think you're going to give an example of how this works, right?
Yeah. So imagine you wake up and you're feeling drained, stressed, maybe disconnected. What you would do is you would complete a morning check-in on the app. We have two check-ins, one in the morning, one in the evening. Now, when you check in, let's say your responses show a drop in mood and energy over the course of several days. What our system does is flags this and instantly connects you with a peer supporter who's navigated similar struggles. Let's say you two chat, the peer shares some tools that have helped them along the way. In comes generative AI. Hold on. So we use generative AI to power prompts that offer, for example, a calming breathing exercise, a grounding practice, or any other evidence-based suggestion or tool that can help de-escalate what you're feeling in that moment. The end result, hopefully the person logs off feeling seen, feeling supported, and maybe a bit more steady. So there's no appointments, there's no waiting rooms, there's no shame, right? And we're not building KindPath in a vacuum. We're actually running a user research survey to help us understand a couple of things. We want to understand how people prefer to receive emotional support, what barriers they faced in getting care in the past, and how comfortable they feel sharing with peers, and what kind of support would actually help them stay engaged. The goal of the survey is to tailor KindPath to real people's needs, not just theoretical ones. So if you've struggled with your mental health, if you've supported somebody who has, or if you care about making the system better, we'd love for you to take the survey and share it with as many folks as possible, because we believe that the best platforms are co-created with the people that we serve. And like Lauren mentioned, like healing doesn't just happen inside of the clinic. It happens in conversations, it happens in community, in being heard and held exactly as you are. So, our hope is that KindPath isn't just an app, but it's a new path forward that honors your lived experience, that activates peer support, and makes support feel human again. And in my humble opinion, if we truly want to democratize mental health care, we have to start here with dignity, with connection, and courage. Yeah. So I really appreciate this opportunity to come on and talk about what we're building at KindPath and how you can have a part in that, actually.
Thank you so much. I'm so glad that you were able to come here today and explain that, you know, in the autistic community, we say nothing about us without us. We want to be included in everything that, you know, people are doing that
Yeah.
is supposed to be for us, but oftentimes we get left out.
Yeah.
And that goes for a lot of neurodivergent people, and a lot of the people who you're talking about. I love that you said that, you know, dignity, community, connection, care, all of these things are really important. And to know that that is right at the forefront of the work that you're doing, that you're understanding the need for accessibility in rural communities and in, you know, people who are really struggling with their finances, and just struggling because there are societal barriers that keep us from having access to the things that we need. It sounds great. I'm so excited. I'm excited to see the survey results
Yeah.
when they do come in. So everybody who's watching, the survey is here on the screen. You can get it here by going directly to the link that is on the screen. And I'm going to read that for anybody who maybe isn't able to read the screen right now. It is bit.ly/KindPath survey.
Yeah.
The other place that you can go is directly to the KindPath website, which is kindpath.health, to get the survey there. So thank you again so much for being here. We will keep sharing this amazing thing that you're doing. And, you know, let's do this. I love that, democratizing mental health care.
Thank you so much, Angela. This has been
Thank you.
Yeah.
Thanks, everybody, for being here.
Okay. Bye. Bye, everyone.